Are you a good patient? This seems like a weird question, isn't it? Namaskar, I am Dr. Ritu Malik and today I'll tell you about the relevance of this question. What do we do when we fall sick? We either Google or we ask our family or friends for recommendations for a good doctor. As per our Sanhitas, the treatment depends on 4 factors or 4 components. The first and the foremost is Vaidya, Bishop or doctor. The second one is Dravya, that means medicines or other equipments required. The third is Upasthata, or the attendant who will be attending to the patient. And the fourth one is Rogi, or the patient himself. When we look for a doctor, we want someone who is knowledgeable and who can treat us well. Our Acharyas knew the importance of a good doctor very well. And that is why they have given doctor the utmost importance. They have mentioned in their Sanhitas 4 qualities of a good doctor. The first one is Daksh. One who is Daksh, who is skilled at his work. One who knows all the components of his work. The second one is Tirth. That means a worthy person whom we can call a doctor. Every day we come across quacks who label themselves as doctor, but they don't have the practical knowledge. They do not have the theoretical knowledge. The third one is Drishta Karma. That means the one who has seen and done practicals. The fourth one is Shuchi. That means who is physically and mentally pure. What do we mean by this? That means the person who is hygienic and who has pure mental intentions, who do not have any malice or any wrong intentions towards the patient. Along with the qualities of doctor, our Acharyas also mention the qualities of a Rogi or the patient. They have mentioned 4 qualities. They have said that Adhyo Rogi Bhishak Vasho Gyapaka Satvavanapi. That means the one who is Adhya, who has sufficient money to pay for his bills, to pay for his hospital stay, to pay for his medicines, to pay for his procedures, to pay for his therapies. Having said that, that doesn't mean that a poor patient do not have the right to have treatment. They do have, but they might not be able to afford the kind of treatment they require at the given time. The second quality is Bhishak Vasho, and that is the most important quality required. That means the one who is ready to listen to the doctor, who is ready to make the lifestyle modifications, who is ready to take medicines accordingly, who is ready to modify his diet and do exercises. The third one is Gyapaka. That means one who can explain his condition very well to the doctor. The fourth one is Sattvavan. That means the one who is mentally prepared about his healing journey, who is ready to encounter all the challenges in his healing journey, and who is patient enough and is ready to make the changes required to make him healthy and disease-free. Apart from the qualities of a patient, the Acharyas have also mentioned certain qualities, or I must say disqualities, which if a person possesses, he or she should be left untreated. Such a person is termed as Tyajya Rogi. Out of the list of disqualities, I'll only mention 2 here. The first one is Vyagra, the one who is impatient, who changes doctor frequently, and who is not ready to give time for the treatment. Every disease takes certain time limit to get treated. If you are not going to give that, how is treatment going to happen? The second one is the one who does not listen to the doctor, who is not ready to make the changes accordingly, who is not having faith in the doctor. And the irony is, these days, almost every patient is Vyagra and almost every patient doesn't listen to the doctor. Talking about the patients, especially those who visit an Ayurvedic physicians, usually what happens, people come to an Ayurvedic physician after the disease gets chronic. They must be having the disease for 5 years, 10 years, 15 years, 20 years, or even more. And they'll come with this thick file and they must have been to every second doctor in the city. Yet, the question they ask the Ayurvedic physician on their first visit is, Doctor Saab, kitne din mein bimari theek ho jayegi? They want results in 15 days for something that they are carrying for 15 years. Is that fair enough? Ask yourself. You need to give that time, not to the doctor, but to yourself to get healed, to get treated, to be disease-free and happy. The second thing, I'm sorry to say, but we are losing faith in our doctors. Again, I'll talk about Ayurvedic doctors. The first thing, usually after the question that kitne din mein bimari theek ho jayegi, what the people say is, Doctor साहब हम काढ़ा नहीं लेंगे, हम चूरन नहीं लेंगे, कड़वी दवाई मत देना प्लीज, एंड नॉनवेज वो तो मैं छोड़ ही नहीं सकती. स्मोक तो मैं करता हूँ, अल्कोहल के बिना कैसे चलेगा, 2 पैग ले लूँ क्या? These are the common things that we come across every day. If you're not ready to make the dietary changes, if you're not ready to make the lifestyle changes, if you're not ready to have medicines accordingly as the doctor advised you with the right adjuvant, how are you expecting the doctor to treat you? How can the doctor assure you 100% that the disease will be cured? We cannot do wonders like this. You need to have that faith in your doctor. You need to surrender to the doctor and listen to him and do whatever he advises you. Our acharyas were super intelligent beings. They have made kadhas and churans for a reason. Because the assimilation of the drug starts from the tongue itself. The absorption increases and there are a number of other factors. We Ayurvedic doctors, trust me, do not like to give bitter medicines just without any reason. There must be a reason that we are prescribing the medicines to you. There must be a reason that we are advising you the dietary changes. There must be a reason that we are asking you to make lifestyle modifications, wake up on time, sleep on time, and do other things. The first principle of Ayurveda is Nidan Parivarjan. Ayurveda का सबसे पहला सिद्धांत है ये. That means to eliminate the causative factor. If you're not ready to eliminate the causative factor and will just have drugs, how come your disease is going to be cured? I'll just advise you to have faith in your doctor, to be a little patient. So next time, when you go out and search for a good doctor, be a good patient first. Jai Hind, Jai Ayurveda. Thank you.